Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
So if you get a lady and she get pregnant and she is on even an alcohol or heroin or any substance that is she's abusing, guess what? The newborn also, the baby inside, isn't the same substance. Even if she's taking alcohol. Some mothers do because they cannot live without being on this substance, whatever they're abusing. So at the time of delivery, the baby, after delivery, he will go through irritability, seizures, drooling, what is this, what's going on? So then when you realize, if you're a smart doctor and you've seen cases like that, this baby is going through withdrawal symptoms. Why? Because the mother was taking something, she was addicted into something, she was depending on a substance, and now this substance, when she takes, it's in her system. And then whatever the mother takes, the baby also takes through the placenta. So now the mother is abusing a substance, but at the same time, the substance is getting to the baby. So now we have an addicted baby inside the uterus. So now when the baby is delivered, he is no longer getting that substance because the baby cannot smoke. So now, what happened to the baby? The baby goes through something called withdrawal symptoms. We cut the substance that the baby system was used to. He's no longer getting this substance, so he goes through signs and symptoms. Some of it could be severe and very bad. So this is also a price that a baby that just came to life, he starts to suffer because of the addicted mother. You see, so it's a bad thing. No matter how you look at it, it's something that is very bad and something that I want everybody out there to think about twice before taking that joint or smoking that or sniffing or shooting. Think about it twice. The complication is very bad. It can lead to your death. And we heard about a lot of people that have died from overdose. Let's take one more break and then we're going to talk about another subject.
Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
I want to share with you something that is very nice for all the patients out there that may have kidney problems. The kidney is a very important organ in your body. The function of the kidney is to filter out the blood. The blood goes through the kidney and the kidney filters out. Anything that shouldn't be in the blood, the kidney is the main organ to filter out that blood. And we, in medicine, we have something called creatinine urea. Okay, and this is our way to know the kidney profile. whether the kidney is good or bad. We measure something called creatinine and something called urea. The normal value is 1.2 to 1.5, I may accept. From 0.8 to 1.2, 1.3 is okay. It's a good kidney. So there is calculation that has to be done, but to make the story short, if someone comes in with a creatinine of 2, we know the kidney is at about 50% functioning. About to come with 3, about 75% functioning. Creatinine of 4, the kidney is no longer functioning. It's very low. Kidney profile functioning is very low. So we rely quickly on, we look at the creatinine value, and then we decide how much functioning the kidney, the kidney is doing. So the kidney diseases we categorize them as, we call it pre-kidney, pre-renal, or a problem in the kidney itself, or something that is happening after the kidney. After the kidney, there are the vascular system and everything else. So we have pre-renal, we have renal, and we have post-renal. The most common cause for kidney injury is the pre-renal. You're not drinking enough, you're dehydrated, so things like this can hurt the kidney, and that's an easy fix. Then we have kidneys problem like necrosis, tubular necrosis, or so many names. Anyway, all those could be looked at, with the creatinine value. We know there is a problem at the level of the kidney. I want to share with you something that I have discovered and note during all these years of practice. I have patients that came with creatinine 3. I give them this product I want to share with you. It's a gum. We can put the picture of that last image, will be great. So it's a gum, is frankincense gum mixed with Arabic gum and other natural herbs. This 2 bottles, he makes it like a tea and takes it, and after 1 week to 2 weeks, the creatinine value is back to normal. And this patient, his creatinine value was 3.7. That means very small of the kidney is functioning. After 1 week of taking this gum, the kidney is back to normal. There is a lot of studies that was done proving that Arabic gum mixed with frankincense gum and a couple of other herbs are very, very good for the kidney, and it reverses the damage of the kidney. But what if the creatinine is 20, 25, 30? That's no. This can lower it small, but it will not. It will not reverse the kidney function. Then in this case, we will have to send the patient to a nephrologist, and dialysis, kidney dialysis, is the most likely thing to be done for these patients. So as long as the creatinine up to 4, we can do it very successfully, without a doubt. It works. When the creatinine shoot 50, 60, 70, that's dialysis right there. It can lower it, but we need to bring it back to 1.5. And this natural treatment will not bring it back to 1.5 from all the way from 60, 70. 60, 70, that's dialysis, especially if there is abnormality with the potassium. Okay, so the kidney does a very important thing in retaining potassium level normal in the blood. So when potassium level start to be abnormal, we have a problem. When creatinine start to show 40, 50, 60, that's very bad. So that we have to consult with a nephrologist, and we have to consider kidney dialysis. Why I'm talking about that? From drug addiction to kidney dialysis, why am I talking about that? Because I get patients, young patients, that they are taking this natural, they call it traditional medicine, for God knows what. She cannot get pregnant, traditional medicine. She has hepatitis, traditional medicine. Her husband is mad at her, traditional medicine. She gets a spiritual attack, traditional medicine. Everything, you take, and they end up with very bad kidney. Young, they're already going into dialysis. I said it before and I say it again. Before you put something in your mouth, ask what is this? What am I putting in my mouth? And everybody has phones now, and you have Google. Google it now, see what it does for you. But if the seller himself doesn't know what he has inside, you have a problem. You're destroying your health. And we said so many examples and so many sad stories about young boys and girls going into kidney dialysis at very young age. You know what kidney dialysis means? A machine will work as a kidney for you. And you have to be doing at least 3 times in a week. They take one blood supply from here, maybe from here, big one, so they can hook up the machine, and then you sit there for like few hours for the machine to filter out the blood. So that means you are bound to that area where the hospital is that has dialysis. You cannot go anywhere for more than a day or 2 because you have to come back for the dialysis. Because if you don't, you're at risk, very high risk for losing your life. Would you want to do that? Prevention then is much easier than going through kidney dialysis. So before you put something in your mouth, know what you're putting in your mouth. Before you go for traditional medicine, it worked for this guy, and they have their own stories. Hey, those are hustlers. They have their own story behind everything. Their only concern is to make some money from you. Whether you live or die is not their business. Whether you get sick or not is not their business. All their concern is money. So they have a story behind everything. This guy got it and he's good now, and this girl got it and she's good now. Everybody that comes in with hepatitis, they tell me they take in traditional treatment. We test for the surface antigen, it's there. So what is the traditional treatment did for you? I challenge anybody out there that took traditional treatment for hepatitis and get cured. Bring them to me. I think we're reaching the end of the session today. I thank you all for listening. God bless you all. And I hope you do the advices that I have shared with you this evening. And I will see you next session. You have a beautiful evening. And God bless you all. Thank you very much.